All right, folks, I'm having a little technical difficulty. Just give me another couple of minutes, please. So we'll start in a few minutes. All right, I'm almost ready, folks. Just give me another minute or two. Almost ready. All right, so you should be seeing my screen now. If not, please let me know. All right, great. Sorry for the delay, but Windows was doing some funny business. Anyway, we are up and running now. So what we're going to do today is we're going to speak about bone markings, right? First of all, I need to give you an idea as to what a bone marking actually is, okay? Now, obviously, you know what a mark is. But when I say bone markings, I must be referring to something specific and special. And bone markings are indeed very special. When you look at the surface of a bone, it is not a cylinder, right? There are parts that are narrow, parts that are wide. Sometimes you have indentations. Sometimes you have grooves, etc., right? So the surface of a bone is much more intricate than that of a flat cylinder. Now, all the intricacies of the bone, all the bits and pieces and holes and narrowed bits, they have names, right? And they have specific functions. So what we're going to be doing is that we're going to be exploring in the specific functions of the bone, okay? Or of the markings on the bone. So this says here, bones have characteristic surface markings, as we just said, and structural features adapted to the functions. Remember, each one of these bits and pieces, bits and bobs, they're there for a reason, okay? They have a purpose. Now, there are two major types of surface markings, as it says here. Depressions and openings or processes, right? So either you have a bit of a part that looks like a scoop out of the middle of the bone, as in a depression. And of course, if you scoop deep enough into the bone, you'll eventually scoop all the way through to the other side. That, of course, is an opening, right? So think of it that way. So either you have a big old indentation in the bone, or you have holes of various sizes. Then now we have processes. A process basically refers to something that sticks out, okay? So a depression sinks in, therefore, and the process sticks out. That said, we already know the major types of bones, but I want to mention a couple more here, which are sort of subsets of the major categories, but that you might come into contact with, so you probably need to know them, right? Now, we did long bones already, and I mentioned short bones to you as well. But let me just go back through short bones again real quick, okay? All a short bone is a bone that is not much longer than it is wide. So it's a little longer than it is wide, but not by a whole lot. That is why it's, of course, called a short bone. So they tend to be sort of cube-shaped, right? And they're just slightly longer than they are wide, basically, right? So it mentions here, short bones can be found in the carpal and tarsal regions, okay? Your carpals are your wrist bones, and your tarsals are your ankle bones. And of course, we'll be looking at them in a little bit more detail later, right? So your carpals and tarsals are examples of short bones, slightly longer than they are wide, okay? Then now you have flat bones, which we did already, and irregular bones, which we also did already, right? These last two here, I don't think we did them. And these are sesamoid bones and sutural bones, okay? Sesamoid and sutural bones. Your sesamoid bone is an interesting one, okay? It is an oval bone that sits on top of tendons, okay? They tend to be oval bones that sit on top of tendons to protect tendons from damage. So your kneecap, which of course is known as a patella, is a sesamoid bone. And I'm sure you've all done this where you grab your kneecap and shift it around a bit. The reason you can move it around so much, of course, is because as you're changing the position of your knee, the kneecap bone needs to be able to shift a bit to ensure that it sits over the tendons in the knee, so it continues to protect them. Right? So sesamoid bones, oval bones, they protect tendons. Then we have our sutural bones. Our sutural bones, now I'm hoping you notice sutural is related to the term suture. And if you know anything about surgery, you know what a suture is, right? So when they sew somebody up, the line that is left is called a suture, okay? So a sutural bone, these are small bones that you find in the cranium, the head, right? And the reason they're called sutural bones is because you have fine little fibers that basically sew these bones together and hold them together, just like a suture, okay? So those are your major categories and some minor subcategories of bone, okay? So when we start talking about bone markings, we will find these markings on all of these bones. Now, obviously, long bones, flat bones, and irregular bones are still by far the most common bones in the body and the most important bones in the body. But you still need to be aware of these also subcategories, okay? Now, bones and their surface marking. We already mentioned that we have depressions and processes, right? Now, what I need for you all to be aware of is just the general types of bone markings. We're not going to get too deeply into it, because I mean, we do have a limited amount of time. There's so much to learn, so little time, right? So here's what we're going to do. This table here will contain all information about bone markings that I would possibly test you on, all right? For example, it mentions what a fissure is, right? So the first part of the table shows depressions and openings, the major ones. So it mentions fissures. I'm sure you heard of fissures when you're talking about rocks. You have a fissure between the rocks, just basically like a narrow opening that runs all the way down, right? So as it says here, a fissure is a narrow slit between adjacent parts of bones to which blood vessels and nerves pass. So you have a bone, you have two bones, and there's a narrow slit between them, and you can run your blood vessels, etc., between these two bones using this narrow slit, right? And it gives examples here of each type. So, for example, for a fissure, you have the superior orbital fissure, right? Now, you already should know superior means above, and of course, orbital refers to your eye socket, as I'm sure you know, right? So the superior orbital fissure is looking at the superior portion of the orbit where the sphenoid bone meets it, right? Then now we have the foramen, and a foramen is an opening, right? Now, some openings can be in bones, some openings, of course, can be in blood vessels. So, for example, when we're doing the cardiovascular system, we would have spoken about the foramen ovale, or ovale, if you prefer, which would have been in the heart of a fetus. So the term foramen is just a hole, okay? So as it says, opening through which blood vessels, nerves, or ligaments can pass, all right? Now, remember, we're talking about bones, not cardiovascular, so our example will, of course, be from a bone. So it mentions the optic foramen of the sphenoid bone. The optic foramen allows the optic nerve to leave the eyeball and then leave the orbit and head to the brain, okay? Then now we have the fossa. And a fossa is a shallow depression, like a saucer, right? And once again, we have an example here of the coronoid fossa of the humerus, which I'll mention in a bit. So we have fissure, foramen, and fossa so far. Then now we have this one called a sulcus. And a sulcus is another furrow, and this runs along a bone surface to accommodate a blood vessel. So a sulcus is essentially a depression that allows the blood vessels to run. Once again, when we were doing the heart, we spoke about the interventricular sulcus on the surface of the heart. And that interventricular sulcus allowed, of course, for the greater cardiac vessels to run between the ventricles. So there was a little depression there for it to sit, okay? So sulcus is basically a long depression, or furrow as it says here. By the way, a furrow, I should mention to you that what a furrow really is. When farmers are planting in their field, one thing they have to do is they turn the soil to drop the seeds. So if you ever seen it, talk about farmers plowing the field, the plow makes a furrow, which is that groove in the ground. And then you throw the seeds in the groove and you cover it up. So that is furrowing. So of course, the groove in the ground is also a furrow in a person as well, right? That's why wouldn't we use farming terms for it, right? Now the meatus, when we're doing respiratory system, we also spoke about the meatus, which of course is a tube-like opening, right? As it says, gives an example of the external auditory meatus here, right? So those are your depressions and openings. Not all of them, just the major ones, right? And then now we have our processes. You'll note here, we have a condyle process. It's like something somebody would name their child one of these days. Condyle process, and if you notice it's a large round protuberance at the end of a bone. So fundamentally, a condyle process is designed to fit in a joint, okay? So it's a bulge that will slide into a joint. Then now we have the lateral condyle of the femur as an example for this one, right? And we also have what we call a facet. And a facet is a smooth surface. And it's called articular surface, of course, because it is going to articulate, it's going to fit into another part of the bone. And if you see the word facet, think of like diamonds and emeralds, the way where they're cut to make them sparkle, right? So they all have all of these smooth, flat, rectangular surfaces connected to one another to give it that sparkle. So each one of those little fluid, smooth, flat surfaces is a facet, okay? So once again, for the bone, is the same thing. Smooth, flat surface. Just like you get on your diamonds and your emeralds when they cut them, right? And it gives the example, of course, of the superior articular facet of a vertebra, okay? Then now we have head. The head is a rounded articular projection that tends to be supported on a neck. I mean, normally heads have necks, right? So basically you have a rounded end of a bone that sticks out from the main bone on a narrow shaft, which we call a neck, right? Now, the best example of this in the human body, of course, is the head of the femur. If you've all seen a femur before, so you know what I'm talking about. The end of the bone, I mean, you even see them in cartoons, right? When you see the end of the bone sticking out and that round protuberance at the end of it, right? That is your head sticking out onto the neck, okay? Then now we have what is called a crest. And if you think of a crest, like on a bird, right? It's a line of feathers that runs down, right? So it sticks out and runs down. So a crest, as I said, is a prominent ridge or elongated projection. So a crest is a narrow, upraised area of the bone that runs down the length, long ways onto the bone, okay? So crests are long and narrow. An epicondyle is a small rounded bit that sits on top of the condyle. We already know the condyle is a rounded end of a bone. The epicondyle, of course, as it says here, sticks out, is on the condyle and sticks out above it, okay? So the epicondyle sticks off of the condyle. Then we have a line. A line and a crest are very similar, except for one. Lines tend to be much lower. Remember I said to you, a crest sticks out above the bone and runs lengthwise and it's narrow, okay? That's a crest. If you have a very, very, very short crest, you can barely feel it. It's slightly higher than the bone and still runs back. We don't call it a crest anymore. We call that a line, okay? So lines are essentially very short crests. Now we also have what we call a spinous process. Now obviously, spinous process, first thing comes to mind, of course, is a spine. And you have all seen spines before, right? As we say in Jamaica, maca all about the place, right? So what is a spine? Sharp, slender projection, which sticks off of the bone, right? Now it mentions the spinous process of vertebra, which we'll be looking at as well, right? Then now we have the trochanter, which is a large projection. So basically a trochanter is a bit of bone that just sticks off of the main bone. It projects off of the main bone, right? And as we're going along, of course, I will be pointing out all of these things on the bones we're looking at, right? Now, we also have tubercles, which are small, round projections. So they're very similar to your epicondyle in the way they look. The difference is epicondyle has to be on the condyle, while the tubercle does not. Well, it's not going to be on the condyle at all, okay? So they look similar, they're not in the same places. And then the last one we're going to worry about here is called the tuberosity. And this is a projection, tends to be big and somewhat rounded, but it's not smooth, right? So it's a large rounded projection sticking off of the end of the bone, right? So so that in some ways it's similar to the trochanter, just smaller, right? All right, so remember now, these here, major bone surface markings that you'll find on the bones. As we're going along, I'll be pointing out their presence on the major bones that we'll be covering, okay? Okay, that said, it's time to talk about your skeleton. We already spoke about the microstructure of the bones, how they grow, how they heal. We spoke about the difference between spongy bone and smooth bone, and compact bone, sorry. So we just spoke about the projections and depressions you find on the bones. Now we're actually going to start classifying our skeleton itself, okay? Firstly, the skeletal system itself, remember, contains not just bones, but cartilage and joints, and the ligaments that, of course, attach the bones together. Hopefully, everybody remembers from CSEC that a tendon attaches a muscle to a bone, but a ligament attaches a bone to a bone, okay? Tendon Remember, muscle to bone, ligament, bone to bone. Now, in an adult, okay, so this is for adults. There are on average 206 bones in the body. Now, I say on average, but because guess what? There are some people that have slightly fewer bones than others, and some that have a few more than others, right? There's genetics to this. At some point in the evolutionary history, several bones would have fused together to form bigger bones, right? Now, here's the thing. Occasionally, people will be born and these bones would not have fused. So that person would have more bones than your normal person because of that. Not only that, when babies are born, they actually have more bones in them than an adult. Lots more bones. We have about 206 babies have 300 odd. All right? So babies are born with more bones than adults are. And as the baby gets older, the bones start fusing together. So by the time they're a mature adult, of course, they have an average of 206. Now, based on what I've just said, hopefully it has occurred to you that this is another good way of determining the age of a skeleton, right? Last time I said to you, you can determine the age of a skeleton by looking at the ends of the long bones and seeing how much cartilage there is in the epiphyseal plate. But you can also look at the number of bones present and how well they fuse together. And this will also give you some information as to how old the person is that these bones are coming from, right? So this is why when archaeologists, let's assume it's archaeologists and not crime, dig up old settlements and find bones, they can age the bones to determine approximately how old the inhabitants were when they died, which is, of course, is why we know on average that people who lived 300 years ago, on average, did not live much into their 40s, right? So I, for example, would have been dead a long time ago, right? Now, they also can use a skeleton to determine the sex of the person who died as well. But when we get to that point, we'll talk about that separately, right? So remember now, on average, 206 bones in an adult. More as a child, they fuse as you get older, right? Now, that said, this 206 bones are going to be divided into two basic groups, right? We have what is called the axial skeleton, and the other one is called the appendicular skeleton. Axial, appendicular, okay? The axial skeleton, I want you to think of it as the main part of your skeleton. That's the part of the skeleton that makes up your head, your chest, well, basically your torso, right? Whereas the appendicular skeleton is looking at the bones associated with your limbs, arms, legs, their point of attachments to your axial skeleton. So when you look at this diagram here, the axial skeleton is what's that? What color is this? Oh my God. Is this aquamarine, blue-green? Anybody know what color that is? I'm gonna assume it's blue-green. You know, that's the best I can do, blue-green. So that blue-green color, everything you see here is a part of your axial skeleton, okay? So the first, and then of course, I'm gonna say yellow, or is that tan? Whatever color that is. That other color there is going to be a part of your appendicular skeleton, okay? Now, notice the axial skeleton contains 80 bones of the average 206. And the appendicular skeleton contains 126, right? So So there's quite a big difference between the number of bones in both. Now, if you're wondering if I'm going to ask you to memorize 206 bones, the answer is no, of course not. At least not yet, right? I will not be asking you to memorize 206 bones. Will it hurt to know the 206 bones? No. But you're going to need to learn at least, well, somewhere in the region of 100 of these bones, okay? Well, maybe closer to 80. So that's not so bad, right? 80 versus 206. And besides, a lot of these bones you actually do know already, right? So realistically, you probably just need to memorize another 50 bones. Now, that said, let's talk about the bones of the axial skeleton. First of all, the purpose of the axial skeleton is as a support mechanism for the neck, head, and the trunk, right? So it supports the body's tissues in the neck, head, and trunk. It also protects the spinal cord, the brain, and the thoracic organs. You'll notice that they don't protect the abdominal organs, right? So, of course, your cranium will protect your brain, and your vertebral column protects your spine, and your rib cage protects your thoracic organs. Your kidneys and your liver and your stomach, them the on the moon, right? And we'll talk about why that is in a little bit. So, first of all, this here is the skull. I'm sure you noticed that. The skull here has more of the bones that you need to know from the axial skeleton than pretty much anywhere else, the individual bones, okay? So this one here, you're going to have to spend some time on it. Now, generally speaking, I want you to notice that the bones that I have here in bold, those ones are the ones that I'm going to say to you, say, boy, those are a must. All right? So let me repeat that. The bones that are in bold are a must. You're gonna have to learn these, okay? No, it's actually not that bad, really. But of course, I would say that, right? Now, let's start with this diagram. You must be able to label this diagram, all right? I know I said all the time, and there's a million diagrams I ask you to be able to label. It's true, I agree. So this is going to be 1,000,001, right? It is what it is. So please ensure that you can label this diagram when you see it. We're going to talk about all the bones in bold in a little bit, okay? All right. Sorry, give me one quick second here. I'm trying to do something here real quick. 1 second. All right, sorry about the delay. I'm going to post something in the chat now, okay? This is the join information for Canvas for this course here, okay? It has not gone live yet, right? But give me a few hours today. I'm another class after this, so I won't be able to do it immediately. But I am going to start, I'm going to make it live and I'm going to upload the lectures we've done so far to it. I'm also going to upload the lectures to the YouTube thing. All right, so that you see, so you can listen to the lectures on YouTube, right? Moodle is not going to work out because as I think I don't know if I mentioned it, but the Moodle file size limit is very small. Okay. So between now and over the weekend, I am going to try and put the lectures we've done so far on YouTube for you guys, right? All right. Yeah. So remember, please take down the URL and the join code I've sent to you. Remember, it's not live yet, but it will be by tonight. Okay. So you can join it then, but you'll need that information to join by. All right, good. Give me 1 quick second here. I need to shut this down and then I'll start again. All right. So give me 1 minute, please. All right, sorry about the delay. So let's go. Remember, check back later this afternoon, this evening, and you will have your PowerPoints, right? Your skull is made up of parts, as everything else is, right? So we have our cranium, which of course is the part where your brain sits, and it also is the part that covers the brain. And we have our facial bones, which of course make up our face. Nice and easy, right? Now, the cranium itself is made up of several different bones, because it would be too easy if it was just one bone, right? And the facial bones themselves are also made up of a multiplicity of smaller bones. The facial bones are used to form the framework of the face, right? So basically, your flesh and muscle sit on top of these bones to give shape to your face. They form cavities for sense organs, like the eye sockets, for example, and the ear canals. They provide openings for the passage of air and food. We're talking about our mouth, our oral cavity now, right? And the nasal cavity as well. Hold the teeth. Where hold your teeth? Of course, we're talking about now the bones of your jaw and anchor muscles to face. Once again, the muscles of your face are attached directly to the bones via tendons, right? Then now, It also mentions here that skull has sutures. Remember, I mentioned to you earlier, a suture is sort of like the same suture you see that talk about in medicine, right? So it looks like when you look at a suture, it looks like two bones have been sewn together with thin thread, right? So these thin threads lock two bones together, and we call that a suture, okay? When you look at the actual cranium, you're going to see what obviously looks like stitched lines crisscrossing the cranium. And we give these sutures, these lines you see that are joining the bones together, names. So we have coronal, sagittal, squamous, and lambdoid sutures. So when you look at the skull, here you go. We can see the sutures. So okay, this is a lateral view. So these here are the sutures. So they almost look like patchwork. You know, like somebody took different patches of cloth and sewed them together, right? So your lambdoid suture is here. This one, right? For example. And then your coronal suture and your squamous suture. You're going to need to know not only the names of the suture, but of course also the bones that make up the sutures, okay? So, which is why it's so important to learn how to label this diagram here. And of course, this diagram here. And, well, not so much that one. It wouldn't hurt though, but more realistically, this diagram here is probably the more important of that, right? So when I talk about the skull, make sure, and keep in mind, most of the things you're seeing here are being repeated from one diagram to the next. You're not going to see a lot of new structures, right? But it's just that they're easier to see from some orientations than the other, right? So remember, this skull diagram important. That skull diagram important. And of course, this one as well, all right? So that's anterior view, posterior view, and lateral view, all right? So anterior, posterior, lateral. Those you need to know, okay? All right. That said, so remember, sutures, coronal, sagittal, squamous, lambdoid. They're found between the bones of the cranium. You need to know the bones of the cranium that are going to make up each suture. And we'll discuss that in a little bit, right? Now, your facial bones are going to form, as it says, the anterior aspect, and the cranium forms the rest. So all this is saying is that your facial bones form the front of your skull, and your cranial bones form the top and back of your skull and sides, okay? Now, it mentions that the cranium is going to be divided into a cranial vault and a base. Now, the vault itself is called the skull cap. Now, obviously, if it's called that cap, it must cover something, right? So it shouldn't come as any surprise to you that the skull cap covers the brain, right? And it mentions here that the cranial vault also includes the forehead. Once again, because it covers the brain, right? So if the bones you're mentioning are covering the brain, they are part of the skull cap or cranial vault, right? Now, the brain itself is going to sit on the cranial base. And everything below that now is going to be a part of the facial bones, right? So, of course, your forehead is still where the brain is. When you touch the bridge of your nose, and from there down, of course, no brain. So that is facial, okay? It also mentions here some of the cavities that your skull will contain. Now we know already that we have an auditory passage that runs through the skull on its way to the middle ear, right? So that's why it mentions here middle and inner ear cavities in lateral aspect of the cranial base. So the middle ear and inner ear are all within bones, okay? All within the cranium. It also mentions nasal cavities, which we mentioned earlier as well. We mentioned the orbits for the eyeballs. And I think we mentioned last semester, sinuses, which are our ear-filled spaces, right? Normally surrounded by either bone or vessel tissue. But obviously we're doing the skull, we're doing the skeletal system, so we're only referring to the sinuses that are surrounded by bone, okay? Now it mentions here your skull contains 85 named openings. I am not going to expect you to learn all of these, right? All I need from you, for the most part, there might be one or two that I mentioned otherwise, but all I really need from you is that you know the major types of bone markings, and you can give an example of each one of them, right? I will not require you to learn the 85 of them in the skull, etc., right? However, of course, openings are going to be there to provide access, right? So it mentions here to provide openings for important structures. For example, like the spinal cord. The spinal cord leaves the brain at a giant opening called a foramen magnum. And the foramen magnum is the biggest hole in a bone in the body, right? It also mentions that you need openings for blood vessels that go to the brain, as well as cranial nerves. Cranial nerves are very important for controlling many aspects of your nervous system. But of course, we're not going to look at them in bones. When we do nervous system, we look at it in a bit more detail, right? Now, your cranium itself is made up of 8 large bones, okay? Some of them are paired, some of them are unpaired. Obviously, paired bones, there are 2 of them. Remember, we are laterally and bilaterally symmetrical. And because of that, we expect whatever is on the left side to be on the right side, right? Now, that's it. Which ones are paired? Which ones are unpaired? Note here that the temporal and parietal bones are paired. Now, these are bones you find at the side of the skull. So when we look at the lateral view here, I want you to look around for your temporal and your parietal bones. Temporal and parietal. Now note, the temporal bone is below the parietal bone, okay? You can see there, the parietal bone is in red. Temporal bone, that looks like orange to me, okay? And what I also want you to notice for me, please, is that between these bones, you're going to have a suture, right? So no surprise, sutures abound. So between the temporal bone and the parietal bone, we have running right here, our squamous suture. So please remember, 2 paired bones in the cranium. The temporal bone, parietal bone, one on either side of the head. Running between them, you're going to have a suture called a lambdoid suture, which of course has to be 2 of them, one on the left side of the skull, one on the right side of the skull, right? Now, the unpaired ones are your frontal bone, your occipital bone, your sphenoid, and your ethmoid bone. Okay? So frontal, occipital, sphenoid, ethmoid. Now, the frontal bone, to be nice and obvious to notice, it's called frontal because it's at the front. All right? So your frontal bone is your most anterior cranial bone. You can see here where it forms a joint with the parietal bone on either side. All right? So here's one parietal bone, here's the next one, and both of them join now to the frontal bone, which of course means we get another suture here. So remember, here's the frontal bone, here's the parietal bone, and between them, you have your coronal suture. So it was lambdoid suture, squamous suture between the parietal bone and the temporal bone, and it is now coronal suture between the parietal bone and your frontal bone. Okay? We also mentioned the occipital bone. So frontal is the bone, is the cranial bone closest to the front or the anterior. Occipital bone is the one most towards the posterior or to the back of the head. All right? So head front, frontal bone, head back, occipital bone. And once again, you'll notice here that your parietal bone is also going to form a suture with the occipital bone. So the parietal bone is very busy, right? It's suturing all over the place. The suture between the parietal and the occipital bone is called the lambdoid suture. All right? So remember, occipital, head back, between the occipital and the parietal, lambdoid. Okay? All right. Now, so how much you got now? So we mentioned the frontal occipital. All right, we need to mention sphenoid and ethmoid bones as well. These are a little bit harder to spot because they are, here we go. They're more on the inside, okay? Let's use the frontal anterior. Okay. So now the sphenoid bone is inside the skull, basically, right? And the ethmoid bone is towards the anterior, and it helps to make up the orbit, as you can see here. Right? So sphenoid bone, ethmoid bone, unlike the other cranial bones, these bones are on the inside. Right? So they help to form the base of the cranial vault. Whereas the parietal and the frontal form, the parietal and the frontal and the occipital are forming the upper part of the cranium, and the temporal bones form the lower sides. The sphenoid, ethmoid are forming the base of the vault, right? So the brain sits, okay? All right.
Sir,
Yes.
since you said that the temporal and the parietal are on either side of the skull and they
Right,
connect
remember,
with,
those are paired.
right, so I was asking, so the sutures that's going to form on the other side of the skull, they will carry the same name?
Same name.
Okay.
But I will mention this. The coronal suture, when you look at it, it runs essentially from one side to the next. All right. So but you can see so you don't have to say it's not a paired suture. It's like one suture going from one side to the next. Or we just call it coronal suture. You don't have to mention that part, right? So the coronal suture runs across the skull, basically, right? The temporal sutures run laterally, as you can see here. Sorry. The squamous suture runs laterally, right? and the lambdoid suture runs posteriorly. Okay. Now, that said, the frontal bones now, as it says, they form the forehead, the roof of the orbits, the superciliary arches, that's associated with the orbits as well. And internally, they contribute to the anterior cranial fossa. They also contain the sinuses. All right. So there's a lot of things going on in the frontal bone. Now, the parietal bones, as I mentioned before, they're very busy. They're forming sutures with everybody, right? So it mentions here, we mentioned the coronal suture already, the squamous suture, and lambdoid suture. But you also have the sagittal suture, which is formed between the parietal bones themselves, right? So here we go. The sagittal suture is between the parietal bones. Lambdoid suture, remember, is between the occipital bone and the parietal bones. And once again, just like the coronal suture, it runs all the way across. Right? So that's one suture running this way. All right. So please remember the major sutures, okay? Remember the bones that they make up or that they join together. Now, your occipital bone is pretty important, okay? Remember, that is the one at, basically at the posterior of the cranial vault. That's the back of the head, right? As it mentions here, it articulates with the temporal bones as well as the parietal bones. So the bones at the top, the bones at the side, all are going to meet the occipital bone towards the back. It forms the posterior cranial fossa, as well as the foramen magnum. And I mentioned to you, the foramen magnum is the biggest hole you'll find, and it's at the base of the skull, right? And so it runs essentially through the occipital bone. In terms of bone markings, once again, I'm not really going to harass you so much on the bone markings here. I just need you to know what the terms mean when you see them. So I need to know what we mean by a protuberance or a foramen, right? I won't kill you about the individual markings for each individual bone. Just keep that in mind, right? So the temporal bone lies inferior to the parietal bone. Remember, inferior means below. And of course, as we all know, temporal refers to time. All right? Why do they call a bone a time bone? I have no idea. Sounds a bit strange, but it's called the temporal bone. Now, specific regions of the temporal bone you need to be aware of course, are the squamous, temporal, petrous, and mastoid regions. Okay. Now, generally speaking, I'm not going to harass you too much about the major regions either, because when you do skeletal system in med, they'll beat you over the head with those. Okay. For our purposes, remember, we're just introducing these things. We don't need to get that far into them. Okay. So once again, just be aware, temporal bone has these regions. I'm not going to ask you about what each region does, what's they're associated with. Just be aware of the regions, okay? Facial bones, there we have, of course, once again, unpaired bones and paired bones. So your mandible is an unpaired bone. Mandible, of course, is your lower jaw. It's unpaired, of course, because you don't have an upper jaw that looks the same as your lower jaw. They are distinctly different. It also mentions the vomer here, which is going to be around the nasal cavity. I'll show you in a minute. And we have the paired bones like the maxilla. Maxilla is associated with the cheeks, And of course, you got two cheeks. So is the zygomatic bones. They have to make up the cheeks as well. You have two cheeks, nasal bones. You have two nostrils. So it makes sense. Lacrimal bones are associated with your tear ducts. So you got two of those too. You have palatine bones, right? So remember palatine tonsils. So you have two of those, so it makes sense. You have two bones for it, right? And of course, you also have our nasal conchae, which we looked at in AMP last semester, right? Now, mandible, jawbone, lower jawbone, is the strongest of the facial bones, right? Now, if you think about it, when you put something hard in your mouth, like I don't know if you ever had one of these jawbreakers. I mean, what is a jawbreaker? A jawbreaker is just layers and layers of sugar, right? So it's extremely dense. When you bite down on a jawbreaker, your ability to crack that thing open is dependent on the strength of your jaw muscles, the strength of your teeth, and the strength of the bones of your jaw itself, right? Now, the very fact that human beings can generate enough bite force to break one of those things is impressive, right? But here's the thing. As much as I just said to you, the mandibles are the strongest part of the human jaw. You have to understand that human beings have very pathetic jaw strength in the first place, right? That's because the muscles associated with our mandibles, our mandibles are very weak, okay? So yes, our mandibles are strong in comparison to the other facial bones, but not in comparison to mandibles of other animals, okay? Something as simple as a chimpanzee can literally bite through somebody's head, right? I've never seen a human being bite through another human being's head. I just don't think it can happen. So keep that in mind, right? Strength is relative. It mentions here that your facial bone is composed of two main parts. The horizontal body, which of course is where you're going to have the teeth, and the upright rami. The rami are important because they help to form the joint with the maxilla, right? With the upper jaw. So here we have our mandible. Okay, so here we have the body of the mandible, and the teeth sit in the body. And then now we have the rami, 1, 2, which forms a joint with the mandibles, right? So when you bite down, what you're essentially doing is that you're pressing whatever you're biting up onto the teeth of the mandibles, and you squeeze them together between the enamel of the teeth, trying to break it open, right? Now, the maxilla, this is the upper jaw now, right? It articulates with other facial bones except the mandible. All right? And this one contains the maxillary sinuses. And those, of course, are the sinuses we associate with our cheeks. And they're the biggest of our paranasal sinuses, okay? I mean, the maxillary bones also form the lower part or the inferior part of your orbital fissure. Remember, fissures, narrow openings that allow blood vessels to pass through, right? So here we have our maxillary bone. And we have the teeth, of course, on our maxillary bone that the mandible will press into when you're trying to bite through something, right? Now, if you notice, I'm not asking you to remember the individual bits and pieces of these bones so far. All I'm asking you to remember so far is the name of the bone, what major bone it articulates with, right? And so far, that's all I'm asking. I mean, it's going to change later on, but for now, that's all I need to worry about, right? Now, These bones here are going to make up the bulk of the face, okay? The ones we're looking at here. So the zygomatic bones, as it says, form the lateral walls of the orbits. Of course, you know that the orbits are where the eyes sit. So just below your eye, when you touch just below your eye, you're touching the zygomatic bones. It mentions the nasal bones, which help to form the bridge of the nose. And we mentioned lacrimal bones earlier, which are located in the medial orbital walls. What does that mean? Remember, medial means closer to the middle of the orbit, right? So now the lacrimal bones are associated with the lacrimal ducts. The lacrimal duct, as you know, is a tear duct. So there's a reason why when people cry, the tears come from the corners of the eye near the nose. As I sometimes when you watch shows and somebody's crying, it looks weird to you because the tears are running from the side of the face, which is not impossible, of course, but they also tend to run mostly down the middle of the face. So when you see people standing up straight and the tears running on the side of the face, why does that look like that? Somebody sprayed water into their eyes, it runs on the side, right? Then now we have the palatine bones. As it mentions here, it forms a part of the posterior part of the hard palate. The hard palate is the part of your mouth, the upper part of your mouth that you touch with the tongue, and it feels like there are ridges in it, right? So your tongue touches your hard palate and it runs all the way back. And then it forms, it'll then go into what we call the soft palate, which of course is the rubbery bit at the upper mouth towards the back of your throat. So hard palate is at the front, right? When you press your teeth against it, you can feel it's very tough and feel the ridges. If you push your tongue backwards far enough, you'll touch the soft palate, which feels rubbery. By the way, just to mention this, some people believe that you can kill yourself, you can commit suicide by swallowing your tongue. It is impossible to swallow your tongue. Okay? Yeah, I see it in movies and I hear people talking about it. You can't roll your tongue back so far and curl it over so far that you can shove it into your oropharynx and then somehow swallow it and block your airway, killing yourself. That is impossible. All right? Just thought I'd mention that because I hear people talking about this all the time. It can't happen. So now we also have the vomer. And the vomer is associated with the nasal septum. Remember, the septum runs in the middle, right? As it says, it forms the inferior part of the nasal septum, which runs in the middle of your nose between the nasal cavities, okay? It mentions that the inferior nasal concha is a thin curved bone that projects medially to form the lateral walls of the nasal cavity. So the concha curves towards the nose. That's the medial, right? And to form the lateral walls of the nasal cavity. Now, obviously, these diagrams will not show the nasal bone, nasal cavity, and the vomer and these things very, very easily. But you should be able to see the vomer from the front. So let's go back to the frontal. Let's see if we can pick it up. Oh, here we go. So here's the vomer bone. Obviously, this is where your nose would be. It's been removed, of course. And this one here comes up and meets the ethmoid bone here. And then on either side now, these are where your nostrils will be. And this bone here now separates the nostrils into two, the vomer bone and the ethmoid bone, right? Then it mentions the inferior nasal concha right here. So it forms, so that little bit of bone is on the lower part lateral of your nose, right? So remember, once again, the ones in bold, please make sure you recognize them and identify where they're supposed to be located, right? Okay. Now, this table here mentions the major markings of your cranial bones. Now, once again, I said to you, I was not going to really test you too much on this aspect of things, and that truth will, well, that is a fact that I will maintain. That said, these are things that you're going to need to know for med school. So even if I don't directly test you on it, I still strongly advise that you review it, okay? Even if it's just before you're going to med, should still review it, okay? Now, let's talk about orbits, the nasal cavity itself, and name the sinuses. I think we've done it already, but we'll do it again. And also talk about the hyoid bone, okay? Now, we did nasal cavity already last semester. So you should be very, very much aware of exactly where the nasal cavity is, right? And this is just showing the major bones associated with that. So the ethmoid bone, and once again, the inferior nasal concha and your nasal bone here, right? You also see your maxillary bone, which forms the inferior wall of your nasal cavity. In addition to that, you can also see where the palatine bone forms the posterior aspect of the nasal cavity, right? All right. Now, the septum, as you know, just like the septum in the heart, is there to split a structure, right? So the septum in the heart splits the ventricles in the left and right. So the septum here is going to split the nasal cavity, the nasal passage into left and right nostrils, right? So here's the septal cartilage. So this is one nostril here. And of course, on the other side, you have the other nostril, right? Now, the orbit, of course, is where you put your eyeballs. If you look towards the back of the orbit, you can see an orbital foramen right here. This is where you're going to have your major nerves and blood vessels enter and leave the eyeball. We also have orbital fissures here, which allow for also for major blood vessels to come in. Okay, so we can already see foramen and fissures in our orbit. Okay. Now the sinuses. You're going to need to be aware of the name of the sinuses. You're going to need to be aware of the location of the sinuses as well, right? Now, there's not that many of them, okay? It's like four, wait, yeah, there's about four of them. What's important, remember, is that you know the names of them and where they're located. We went through this when we were doing respiration as well, but just to remind you, your paranasal sinuses are spaces in the bones of a skull that are designed to help lighten the skull. Okay? They're also lined with mucous membranes and act as a resonating chamber. This is stuff I would have taught you last semester. Now, the frontal sinus is in the frontal bone. So that makes it easy to remember, right? Frontal sinus, frontal bone. Now, the ethmoid sinuses are, no surprise, associated with the ethmoid bones. All right? As you can see here, they're more towards the middle of the head and behind the frontal sinuses. And behind the ethmoid sinuses, you have the sphenoid sinuses, which of course are in the sphenoid bone. which of course helps to make up the posterior aspect of your nasal cavity. And then now you have the maxillary sinuses. Maxilla refers to, of course, near the cheeks, okay, as you can see here, okay? So please remember the names of the sinuses, where they're located. So if I show you something, a diagram like this, you can identify the sinuses, all right? Now this bone here, the hyoid bone, is one that we've mentioned before when we're doing the, what do I call it? The larynx. And I said to you at the time that the hyoid bone is special because it is the only bone in the body that does not form a joint with other bones, right? As it says here, it is the only bone with no direct articulation with any other bone, and it acts as a base for the tongue. So as you're speaking and your tongue is moving around your mouth, the hyoid bone helps to hold your tongue in place so it doesn't, so as it's moving around, it stabilizes your tongue basically. Right, it's the base of the tongue, right? Now, once again, I'm not going to require that you know the major parts of this bone either, okay? Just be aware of the name of the bone, what it's for. All right. So we've covered all the parts of the skull that I'm going to cover. Obviously, we could go into a lot more detail where the skull is concerned, but once again, we have a very narrow course, so we can't spend too much time on it, okay? All right, vertebral column. The vertebral column in adults is formed of 26 bones usually. Once again, there can be variation in the number of bones from person to person, but the norm, let's call it, I won't say average, I'll say norm, is going to be 26, okay? Now, of these 26 bones, you're going to need to know 26. I'm going to be honest with you, you're going to need to know all the vertebral bones, right? Because the vertebral column is extremely important for, I'm hoping, obvious reasons. Now, what does it do? The purpose of the vertebral column is to transmit the weight of the trunk to the lower limbs. What does that mean? It means the weight of your upper body is held by the vertebral column, which then transmits that weight to your lower body. Okay? So it helps to keep you upright, basically. Now, as it says, it serves as a site of attachment for muscles of the neck and the back, which is where the keep you upright part comes in, right? It also surrounds and protects your spinal cord. Your spinal cord is very similar to your brain in its consistency, okay? Brain matter and spinal cord matter is soft beyond anything you'd expect. If you ever, let me explain what I mean by that. If you've ever done like cornmeal porridge, I'm assuming everybody has had cornmeal porridge. And you know, you had your porridge and you leave the porridge to cool. And when the porridge cools, it forms like a skin on the surface of it. That's the consistency of your brain. It is really easy to damage, right? As a matter of fact, some cultures, the brain is considered a delicacy. For example, they'll eat monkey brains. What they'll do is they'll cut the top of the monkey skull off and they'll squeeze like limes and a mixture of like limes and peppers and vinegar onto the brain. And then they'll scoop out the brain with their sauce. So you can literally eat the brain with a spoon. That is how soft it is, okay? Now, the vertebral column, and obviously that also holds to the spinal cord, right? Which is why they have to be covered by bones. The vertebral column is held in place using ligaments. Mentions here the anterior and posterior longitudinal ligaments, as well as a ligamentum flavum, okay? Notice these are in bold. right? I'll point out where those are in a little bit, but for now, this lovely diagram here is of your vertebral column. I want you to notice that the vertebrae of the vertebral column are separated into sections. And the separation is not arbitrary. The vertebrae themselves actually look different from one another as you're moving from one region to the next. And because of that, you're going to have to learn what the vertebrae are supposed to look like in each region, okay? So when I say cervical region, like right here, it says that there are 7 vertebrae in the cervical region. Therefore, there are 7 cervical vertebrae. And we call them C1 to C7. And I also want you to notice that this part of the vertebral column has what we call a concave curve, right? A concave curve. What do I mean by that? I mean, it kind of curves out like that. I've made it a little extreme, but it's like this, right? Now, the thoracic part, which of course is your chest now, that also has a curve. And that curve is going to be convex. So when you look at it, it curves that way. That was a bit strange. So remember now, the first part of the vertebral column, that's the one that has a concave curve. The second part of the vertebral column, which is here, that one instead carries a convex curve. Change the color. We're going to talk about the curving in a little bit, right? Now, the thoracic vertebra, you have 12 of them, and they're listed as T1 to T12, okay? So those are the vertebrae in the thoracic region. Remember, cervical vertebra, 7 of them, listed C1 to C7. Thoracic vertebra, 12 of them, listed T1 to T12. Now, between the vertebrae, you'll notice there are prominent intervertebral discs. And as you know already from CSEC, these discs are here to cushion the vertebra as they sit on one on top of the other. And as the weight of the body presses down on them, they will cushion the vertebra to reduce damage, okay? Now, below the thoracic region, you'll notice there's another curve, and this curve is concave, right? So we go concave, convex, concave, right? Now, the lumbar region now, which is what we're looking at, are the lower back. There are 5 vertebrae. So the lumbar vertebrae are the fewest, L1 to L5, okay? And below that now, the last part of your spinal column, your vertebral column, I should say, is the sacral region. This part joins the 2 parts of your pelvis together. And the vertebrae here are different from the other ones because they are fused together. If you think about it, the weight of the entirety of your upper body sits on top of the sacral vertebra. And because of their position, you don't need to do a lot of moving in this area. So you can just fuse now these vertebrae together to give it more strength, even if it does limit movement. But once again, you're not really moving very much here anyway, right? So remember, cervical, transverse, lumbar, no fused vertebra. When you get to the sacral region, fused vertebra, right? Now, below the sacrum, you have what is called a coccyx. and that is 4 fused vertebra. This is one of these bones that varies quite a lot. So if you're gonna have extra bones, more often than not, is you have extra coccyx bones. So you normally have 4, but realistically, you can have anywhere between 4 and 6 of them. The coccyx bones are what we refer to as the tailbone. So when somebody says they broke their tailbone, that's what they're talking about, right? Now here's the thing. The coccyx actually is a vestigial tail, all right? People keep forgetting that human beings didn't appear by magic one day, right? We evolved from other animals. And during the course of evolution, certain characteristics that our ancestors would have had, we would have lost them entirely, or we would have had them reduced to the point of uselessness. Remember, this is the reason why we have vestigial features, right? Vestigial features. They're there in us. They really don't serve any purpose, but hey, they're here. It's like the hair on our skin. The hair on your skin is vestigial. It serves no purpose whatsoever. The hair on your head serves a purpose. The hair under your arm and in your groinal region serves a purpose, but the one on your actual skin doesn't really serve any purpose, right? Now, that said, your coccyx is the remnants of tails, right? Because, of course, human beings are evolved from monkeys, and monkeys tend to have tails. Now, that said, let's talk briefly now about the curves, right? Remember, cervical region, concave curve, transverse region, convex curve, lumbar, concave again, and sacral, and the coccyx as well, are all convex curve. Now, here's the thing. The curving of the human spine is actually detrimental, all right? The curving of the human spine is poor evolution. What by that I mean, the curves in the spine work better for an animal that spends a lot of time walking on all fours, right? But for an animal that stands vertically, the curves are a problem, all right? So please listen to this carefully. Let me just clear this up a bit. Most people, and I do mean most people in their lives, will suffer back issues. They will range in seriousness, of course, but ask anybody over the age of 50, damn near everybody tell us they have some kind of back problem. Hell, people in their teens are having back problems, much less. And a major reason for that is the curvature of the spine. Because of the way the spine curves, the force of the weight of the body is not distributed properly. So, for example, the force of the upper part of the body, head and neck, goes down so, which means it forms an angle with the rest of the spine, right? So your head is constantly trying to fall forward and bending your neck forward. There's a reason why you see so many people have this thing when they kind of hunch forward. Maybe some of you do it too, It is because of this concave curve. It makes you want to lean your head forward. That's why it takes so much conscious effort to hold your head straight, as we call it, right? Because it feels uncomfortable. Because our spine is curved. Then now, if you take the same idea, the force on the vertebra come down as well, like that. So this is also out of alignment with the other vertebra, which also means you're putting inordinate force. So once again, let me draw that line better. Let's draw that line better. So once again, as you can see, at some point, that's where you want to go. Instead, you end up over here. So that means that from this point on, you're going to be putting a lot of pressure on one part of the vertebra and less pressure on the rest of it. This is how you get a hernia. Okay? So instead of spreading out the weight evenly on the vertebrae, you're putting more weight on one side than the other. Over time, that's why you get hernia. So the human spine is prone to becoming herniated because of the curves. And if you look at the lumbar spine, there's another curve again. And once again, because of the curve, when it hits the sacrum, you can see that the vertebra doesn't sit properly on the sacrum. So it is trying to bend away from the sacrum, which once again puts low pressure on your lower back because of the weight. And of course, human beings are also prone to having lower back problems. Okay? So the curving on the spine is a problem. All right? It makes our spine less efficient at bearing the weight it has to bear. Okay. Any questions there? Does that make sense to everybody? All right. And keep in mind, as I said to you, yeah, go ahead.
Sir, this is the sole cost of hernia.
I'm not hearing you.
What causes it?
I'm still not hearing you. Hold on, let me turn on my speaker. All right, come again.
You hearing now, sir?
Yeah, a little better.
I'm asking if that is the sole cause of hernia, if nothing else can cause it.
If nothing else can what?
Cause hernia.
No, I mean, there are things that can cause hernia for sure. But here's the thing. A herniated disc, which is the kind of hernia I'm referring to. So I'm referring to a specific kind of hernia here, where the vertebra shift position, and because of the shift in position, they press down on the vertebral discs and cause them to rupture. Okay, so that's a hernia of that's a herniated disc. That's one of the most common forms of hernia. You have other forms of hernia which cause the protrusion of an organ into a space. So for example, you can have an abdominal hernia where loops of your intestine get pushed in between the abdominal muscles, right? And get forced forward. That's a different thing from this, okay? This kind of issue with the vertebral column, as I said to you, is universal. If you live long enough, you're going to have back problems. Make it worse, if you have a demanding job that requires lots of lifting up of things, you're going to have back problems. And there's a reason why we have the quote-unquote right way to lift something and the wrong way to lift something. It is because if you bend forward and try to just pick it up, the angles of your vertebral column and make it easier for the weight to pull down on the vertebra and burst the discs open, right? That's why I said when you're lifting something, try your best not to bend your back because it really can cause serious problems. And I can imagine you're lifting block all day, walking around heavy weights all day. Over time, the weight of it on your spine, and the fact that your stupid spine doesn't align properly, you're going to have back problems. I don't know one workman who's been doing it for a while that doesn't have a back problem, right? And what you're looking at here is basically poor evolution, right? So our very, very distant ancestors did the all fours thing. And of course, if you're doing all fours, then this arrangement here is perfectly fine. This arrangement actually gives you a little advantage when it comes to running, because your vertebral column can act almost like a spring to push you forward as you're running. It doesn't do a thing for you if you're standing upright. It's a detriment, right? So human beings have probably the worst back in the animal kingdom. Simple as that, right? So later on, we're going to look at herniated discs. I don't want to start it now because I won't be able to finish it in time. I'd rather do it all together. But so I think it's tomorrow when we come back, we'll talk about herniated discs and we'll talk about intervertebral discs and how the hernia can happen in more detail. But I mean, it wouldn't surprise me if I ask you if some of you right now, as young as you are, probably have back problems already. It might not be a consistent back problem, but you must have rolled to your bed in the morning and your back hurts. You're like, what the hell is going on? Right? It just means you sleep kind of bad. And the pressure on your spine was enough to put pressure on nerves, right? Because of the stupid shape of your spine. Remember? Concave in the cervical region, convex in the thoracic region, concave in the lumbar region, convex in the sacral region, right? So they alternate, starting with concave. And I already explained to you why this is not good. If you had a completely straight spine, then the weight of your body would be more evenly distributed on the vertebral column and on the intervertebral discs. So they will be less likely to pop open when you're doing anything heavy. Okay? All right. I don't want to start this yet. That's what I want to finish it on time. All right. It's 12:43, so we'll stop over 5 minutes early today. So tomorrow we'll finish up this, and then we will do appendicular skeleton. And then that will be it for the skeletal system. Remember the information I sent you in the chat. As I said, give me until tonight and I will activate that account and I'll put the lectures on there. And I will also, once again, be loading the videos onto the YouTube channel. I don't know, did I give you the link to the YouTube? You should have it from last semester, right?
Yes, sir, but it's having some trouble with it for some reason.
All
When
right,
I clicked on
we'll sort that out tomorrow. Somebody mentioned scoliosis. We're going to discuss scoliosis, kyphosis, and lordosis, all of those tomorrow, because there's more to spine problems than just scoliosis, right? A lot of us right now are probably suffering from lordosis and don't even know. But we'll talk about it tomorrow. All right, folks, let's call it a day. I will speak to you all tomorrow.